to the first of our 2021 Mental Health Mondays. I'm Debbie Plotnick. I'm Vice President for State and Federal Advocacy at Mental Health America, and we're so happy that you could join us today. We've got some amazing speakers, and we've got some wonderful programs coming up as well. This is the first, as I said, so here we are today, where we're going to be talking about how to use the relief money that has come through the COVID packages and the monies that will be coming through other sources. And following week on May, just after Mother's Day, we'll be talking about maternal and perinatal health. The following week, we're going to be talking about crisis services and suicide prevention. That will be on May 17th. And we'll wrap up our series of Mental Health Mondays on the 24th with a virtual Hill Day. And you'll hear all about legislation that is pending in the federal government, and a couple of things that are pending in the states, and how you can take action on that. But let's get to today's program. We have wonderful speakers who are part of our MHA family. You're going to first hear from Mary Giliberti, and Mary is the Executive Vice President for Policy at Mental Health America National. We'll also be hearing from two of our wonderful Regional Policy Council representatives. We'll be hearing from Ben Harrington from the Mental Health Association of East Tennessee and Shana Mobihill from Mental Health Minnesota. And Mary's going to begin in a minute by doing a presentation called Show Me the Money. What better presentation could there be right now with so many dollars flowing into our states and localities, and that our affiliates can take advantage of. And then Mary will engage in conversation with Shana and Ben. I would like to remind everybody that the slides that Mary will be using will be available to you in about a week after this webinar. You will also be able, at the end of Mary's presentation and her chat with Ben and Shana, to engage with them and ask them questions. So thanks so much for joining us. I also want to remind everybody you'll all be in mute until it's time for questions, and you can put your questions in the chat. Mary?
I am so excited to be able to chat with you today. My presentation, as Debbie started us off, is Show Me the Money, new federal funding opportunities. And I'm going to be talking about some of that coronavirus relief fund. But first, I just want to thank all of you, because the way this works is Congress hears from people. And thank you to all of you who responded to our alerts, who met with your legislators, who really talked to them about mental health and substance use needs in your communities. That's why we have these resources, and we want to make sure that as they're pushed out, you all are able to take advantage of them. So 3 bills down, several still to go. So we have the Coronavirus Aid, Relief, and Economic Security Act. Short form is the CARES Act. And that was last spring, March of 2020. Then we had the Consolidated Appropriations Act of 2021, and that just happened last December. And it's called consolidated because it's the annual appropriation. So every year, Congress appropriates a certain amount of money for that next year. And that bill had all of that, and it had coronavirus relief funds. I'm going to talk mostly today about the relief funds. And then there was the American Rescue Plan Act, and that happened in March of 2021. What's going to happen in the future? Well, we're going to have a 2022 appropriations, because that happens every year. And then we think there'll be additional bills. The president is already talking about the American Families Plan and a lot about infrastructure. So there will be some additional legislation that we'll catch you up on later. Right there is a photo of a referee, because the parliamentarian in the Senate is the referee when certain procedures are used. And if you've been reading the newspaper, you probably hear people talking about whether the bills can be passed by 50 votes, and that's a process called reconciliation, or we are in regular order, which is 60 votes, particularly in the Senate, because the Democrats right now have 50 votes in the Senate. So we're not clear yet what these new bills are going to be, if they're going to be done under reconciliation or regular order. One thing to keep in mind is if they're done under reconciliation, some rules apply. And that parliamentarian, that referee says, yes, they fit within the rules, or no, they don't fit in the rules. And they're named after a senator, Senator Byrd. And the bottom line, we could go on and on about this, but that's not very interesting. So I'm just going to tell you that the main point is that a reconciliation bill has to be mostly about money, federal money, either taxes or spending. It can't be what they call incidental, that the money's just incidental to the other things that you want to do. So we're not sure yet whether we'll have to use this process or whether the Democrats will use this process. It does mean that there would be restrictions on some of the things that they would be able to do. So what mental health and substance use dollars are out there right now, already passed and ready to come down to all of you in local communities? Well, community mental health block grants, that's a lot of this money, 1.65 billion, with half to states and half to community mental health centers from December, and another 1.5 billion from March. And then the substance abuse prevention and treatment block grants similar. And I just want to stop for a minute and sort of look at that B in billions. Typically, mental health and substance use money, we haven't been in that realm. And that's very exciting for us, that all the work that we've done to advocate, to raise our voices, to talk about the needs, we all know that the needs are in the billions, but the money has never followed that need. So that's very exciting for all of us. There are also many smaller grants in the American Rescue Plan Act, $100 million for the behavioral health workforce training. That's going to be for training behavioral health professionals, peers, and others. $50 million for local mental health needs. Those will be direct that nonprofits can apply for. $30 million for local substance use needs. And then we have some suicide prevention, child trauma network, stress network grants, Project Aware. And Project Aware is school mental health dollars. So for those of you who've been working in schools, specifically on mental health, those are some dollars that will be coming down that must be spent on school mental health. And then other grants are in there. There are lots of funds that are big buckets of money where mental health is one of several uses for the money. In other words, they give you the money and they say, hey, you can use it on 10 things. So in those instances, we don't know whether mental health will be a big part of how the money gets used or it won't be any at all. And that's really going to come down to advocacy. So it's very important to look at these other buckets of money. One of the biggest will be educational dollars coming down to state and local education agencies. That money can be spent on mental health, but that's up to the local and state education authorities. The public health workforce. There was $7 billion for public health workforce. That's going to come to local public health agencies. But again, whether they're going to hire behavioral health workers or not, still up in the air and really will take some advocacy. Rental assistance programs, of which up to 10% can be used for case management and other services, and homeless assistance dollars, which can be used for supportive services. I know some of our affiliates work in the housing area, so these are buckets of money to look out for. Medicaid opportunities. So many of these Medicaid changes are optional. What does that mean? That means a state has to come forward and say, I want to take advantage of this. So that means advocacy with the state Medicaid agency, with your governor, with your behavioral health agency to kind of influence the Medicaid agency, and with your legislators. So here are some of the examples of things that could really matter to mental health and are optional. So states that have not expanded Medicaid. I know some of you have been working so hard to get Medicaid expansion in your states. There's a little carrot in the bill that gives them an extra 5% match from the federal government, meaning that for every dollar, the federal government will give them that percentage. Now it's even 5% more than what they were able to get before. Mobile crisis services, 85% matching funds. That means for every dollar, the federal government spends 85 cents of that. $15 million in planning grants. So you want your state to get one of those planning grants and start setting up mobile crisis the way we need it. 988 is going to be implemented. That's the 3-digit number for mental health and substance use crises. It's also known as the suicide hotline, that will be expanded to handle all kinds of crises. Once that 988 number comes into play in July of 2022, we have to have the mobile crisis in place to address those calls when it's needed. And it's a major equity issue. I know many of your affiliates, just like the national office, have been working to promote equity. And we know that having a crisis response be a healthcare response, not a law enforcement response, is an important equity issue. So really would urge everyone to be advocating for that option in your states. Postpartum individuals, covering up to 12 months after a birth of a child. So that's another one that really will address some of the disparities in maternal mental health. But it can be used for all coverage for all kinds of services. So it'll be up to advocates to make sure that first they choose that option, and second, that it covers well maternal mental health services. An additional 10% FMAP, again, that matching percentage for home and community-based services for 1 year time period. Now you might think home and community-based services, does that affect mental health? That includes all the mental health services that are provided pretty much in the community. So things like crisis services, peer services, those would qualify to get that extra money. Advocates will have to make sure that once the state gets this additional matching percentage, it stays in home and community-based services. It expands access and doesn't go for other things. Additional information, we've done a question and answer document. The link is right there. You're all going to be getting this PowerPoint, so don't worry about taking notes or clicking on it now, but you'll be getting the PowerPoint. There's a document we've done that gives you some strategies for finding out about opportunities in your state. State associations of nonprofits is a great resource. They're always keeping track of money that's coming into the state. And other partnerships that you can use. If you're working with someone now, and I know we're going to talk more about this with Shauna and with Ben, but if you're working with partners that you've been doing programs with, that's a great place to start learning more about how the money is coming down. State mental health agencies, they are responsible for distributing those block grants. So keeping in touch with them and watching when requests are coming out for those funds, very important. They had till April 5th to submit their plans for the December money. So get a hold of that plan, take a look at it, see where you could fit in, and know that they're going to very soon be planning for the March money. And then the document also provides more links and details to these other funds that I mentioned, housing funds, education funds. So you can learn more about what's available there and who to partner with to take advantage of all of those resources. That's our contact information, and you can contact me if you have any questions and you're an MHA affiliate or associate. I'd be happy to help you and to talk through and answer any questions. Thank you so much. And now we will move into our conversation with our affiliates on resources that they have taken advantage of. Welcome, Shanna and Ben. So great to see you. Shanna is with the Executive Director of Mental Health Minnesota, and Ben is our Executive Director of the Mental Health Association of East Tennessee. And wonderful to see you both. Thank you for joining me. And I'm going to start us off asking each of you to give a little bit of information about your organizations. We'd love to know more about the budget, the size, how things were prior to the coronavirus. Just give us some context to kick us off. Ben, do you want to start us out?
Well, I'd be happy to. The Mental Health Association of East Tennessee was founded in 1948, so we're approaching our 75th anniversary. We have 15 employees, and we serve the east end of the state of Tennessee. So that means Chattanooga, the Knoxville area, and all the way north to the Virginia border. Our major programs and services are school-based outreach through a program we designed more than 20 years ago called Mental Health 101. teaching kids what to recognize when they've got to act on what they recognize and where to seek help. Serves about 32,000 students a year in 125 schools. We also have a call center that's staffed by nationally certified peers to help others who want to find a treatment place, a treatment home, and enter and stay in treatment and start their journey to their recovery. And then, of course, we also do a significant work with regards to mental health screenings and screening promotion across the entire Grand Division of East Tennessee. Our budget pre-pandemic was about $830,000 a year.
Great. And Shauna?
Hi, a little bit about Mental Health Minnesota. We were founded in 1939, so recently celebrated our 80th anniversary. We are a statewide organization, so we serve the entire state of Minnesota. Our office is located in St. Paul in Minnesota, but we do, most of our programs hit almost every county out of 87 counties in Minnesota. We do a few different things. Certainly public policy advocacy is an important piece of what we do. We also do a lot of education. So out there in the community doing presentations and other things. And then we do a few direct service pieces. We do run a mental health helpline to have people, to help them just find information and resources. Our biggest program is our Minnesota Warm Line, which provides peer support to people who are struggling with their mental health. That's our largest program. And then, you know, as Ben noted, we do a large number of screenings and promote that significantly as well. Our staff prior to COVID was around 15. But we only had 3 full-time staff members. The majority of our staff members are peer specialists who work part-time, mostly serving our warm line. We also have a number of volunteers and interns who help us staff the helpline and other programs and services. And our budget pre-COVID was around $400,000 a year.
All right, now let's talk about that money that you went after. Do you want to start us off, Shauna, about the money that you sought out for your organization?
Sure, I'd be happy to. You know, I'll just note a few different opportunities that we were able to take advantage of. The first was the Paycheck Protection Program loans that were available. There was one round available last summer, of course, and then a second that was available here just recently. That is still open. And so we were able to take advantage of those. You know, unlike some of the small businesses that may have struggled with whether or not to take on those loans because they didn't know, you know, they didn't really have anything for their staff to do during that time. They may have been closed. We had the opposite problem. We had, you know, we were busier than ever. And so those loans were really integral for us to be able to maintain cash flow, particularly last spring and early summer when things were getting really tight because a lot of the fundraising and things that we normally would do, just we weren't able to do. And yet there weren't a lot of other opportunities yet available for us. So that really helped us pay staff and maintain those services I outlined earlier. We also applied for an economic injury disaster loan or an EIDL loan. And so we were able to get funding through that as well. Because we applied early, we also were able to get the $10,000 advance, which ended up being forgiven as well, just like the PPP loans. So, I mean, they were essentially grants that we were able to get for the organization that won't have to be repaid. A couple of other opportunities we were able to take advantage of. One was CARES Act funding. And we got that actually kind of routed through a couple of counties in Minnesota. And that came a couple of different directions. One, I was contacted by a county that I had worked with on some other things. And we were in a lot of the same meetings. And so she was very familiar with our warm line service. And so reached out to me to see if we might be interested in partnering with them to spend some of their CARES Act funding. And so, you know, I said, sure. And we serve, their county is the third highest in terms of the number of people that we serve. And so we're able to really demonstrate some good impact there. The other county that we worked with CARES Act money was just, it was an application, and essentially they were trying to just get the money out the door at the end of the year. And so we had the opportunity, primarily because we have an office located in that county, and we were again able to demonstrate the number of people utilizing our warm line service from that particular county, and I got $50,000 from that county. Finally, I was able to attain some of the FEMA funds that came into our state that were intended to help pay for mental health crisis services. And so those funds allowed me to increase the number of hours that our warm line service is open. And so normally that's just open in the evening, and we were actually able to double the number of hours that service is open and add some daytime hours as well with that money. So between all of those things, alongside, COVID also helped us kind of open some doors to some other funding from the health insurance companies and others. It actually sort of turned out to be a really good year for us financially, which we did not anticipate, at the beginning of the year, certainly not even in the middle of the year. So the last quarter looked really good for us because we were able to take advantage of some of these opportunities.
Fantastic. Ben, how about you? What resources did you make available?
Well, our organization is much like Shanna's, nonprofit businesses are businesses. We all had to try to take advantage of the PPP loans when they were available to us, as well as the small business loan. And in essence, that's to replace lost revenue that we would have had. And for our organizations, that's lost revenue that often would have come through fundraising activities that got postponed and then got canceled because of COVID. And those things did help us keep the doors open, keep people employed, and keep people able to do the valuable things that we do to serve East Tennesseans. But so those were the things that we did. And then later in the year came what's called Tennessee CARES Act funding. And the state of Tennessee actually held some federal money to roll out to various types of businesses and allow them to apply for COVID-related funding and identify, whether that was reimbursing for expenses that weren't reimbursable by the PPP funds, or was it some other COVID-related funding? So what we did was we actually had managed our operations, and we were able to see the influx of calls to our call center, the increase in screening utilization through our screening program, and we realized there was a distinct COVID-related mental health consequence, and we used that to apply for the Tennessee CARES Act funding and really suggest to the state, we have now thousands of people that are troubled. They're very fearful, they're worried, they're anxious, they don't know what it is, but somehow we have to help them figure out it's real and diagnosable and what that condition is. And so they gave us a significant grant to be able to promote free mental health screenings across our Grand Division, and that actually drove our screening utilization up significantly. And we were able to help people find out they were indeed troubled and what it was that had a name, and then they could enter treatment as a result of that.
So can you talk a little bit, and Ben, maybe you can start us off, because you were just sort of starting to talk about this, what kind of data, tools, strategies you really used to garner these resources, to make the case, which it
Right.
sounds like you really did, to the funder about why this was so important. Can you talk a little bit about those strategies, relationships, kind of how you did this?
Well, first of all, our organization is probably like so many others that collects its data on a monthly basis, and we report to our board of directors frequently about what's happening in those programs. And so we started to see these numbers change, and to be fair, we were tipped off. Paul John Friedel sent out an email in March that said, hey, we're seeing anxiety screenings spike. Y'all might want to pay attention. So we started paying greater attention, and we were able to follow that. But all of that increase in call volume, the change in the existing clients we had now having much greater needs for support, that plus the increase in screening volume was able to steer us to the conclusion we needed to act and take advantage of every emergency fund that became available, whether it was from local foundations, community foundations, or United Ways, that sort of thing, but also then collect that information moving forward so that we would have other opportunities to leverage resources in the future. And that's what we did with the Tennessee CARES Act resources, and then that experience has helped us leverage additional funding moving forward today.
Fantastic. And Shanna, do you want to talk about the same for your funding, kind of what data and strategies you used? And it sounds like relationships were really important in yours as well. So maybe you can touch on that.
Yes, I think relationships were absolutely key to our success here. I was approached by the person from the county that I mentioned simply because I had worked with her for a number of years, and she knew about our programs, and in fact, they had added our warm line data to an overall dashboard that they have on their county website to show the impact. And so that's an example. I was also reached out to by a person at DHS about the FEMA money. I kind of joke that, not that I enjoy working on weekends, but yes, I will accept a text coming in from DHS that says, hey, we've got this pot of money, do you want some? So it was a good opportunity, and certainly really reinforced the importance of building and maintaining those relationships. I think being able to move quickly was also really key to our success. And that's something that, as a smaller nonprofit, we're able to adapt and pivot a little more quickly. But I think we can all do more to set our organizations up to make those adjustments as quickly as possible. And as an example, when I learned of some of the opportunities with the Paycheck Protection Program, for example, or the EIDL loan, I contacted my board right away via email, said, here are some opportunities. Can I get the go ahead to dig into these more and apply, and then we'll see what happens, and we can always turn it down, but let's get ahead of this as quickly as possible. And so, the more we can do that and at least take those initial steps and have that flexibility, I think was really key to us being able to take full advantage of some of those programs, including that $10,000 advance that ran out rather quickly, frankly. So we wouldn't have taken advantage of that if we had applied later. I think the last piece is really, and Ben touched on this too, simply being able to really demonstrate the impact of your programs and tie what you're doing to what's happening in the world, and particularly around COVID in this case. And, I'd give an example. Our screening numbers were up 600 or 700% in the last months of 2020 over 2019. That has really helped us make the case for what we see as future needs coming down the pipeline. We've also been able to track a lot of good data around our warm line in terms of what people would do if they couldn't reach us. And so 1 in 4 of our callers tell us that they would either go to an emergency room or call EMS or crisis if they couldn't reach us. Well, that gets expensive real fast. And so that has really helped us to make the case with both past and potential future funders around, there's a real return on investment of these programs. And that has really helped sell that and continue to maintain that relationship with, the CARES Act funding with that county and some others.
Fantastic. And how is that resources, are they still being used today? The ones that you got from the CARES Act, are you still using it for the purposes that you originally sought that money? And what about long-term sustainability?
So primarily most of the money that we sought out that was from the CARES Act and related FEMA and those things was for our warm line. And that continues to be used for that service. It is our most expensive program and most highly utilized. And so we need every penny to help fund that program. Now, the funding that came in through the EIDL loan or the Paycheck Protections, and so keeping the lights on, buying all the equipment we needed to do remote work, a lot of those things that we need to pay for that, it gets difficult to bring in the money for that through grants and other things because that money is dedicated more directly to paying the specific program staff. So we are continuing to utilize those funds, and we've been able to grow some of them as well and keep them going.
Great. Ben, do you want to address that too? Are the programs continuing, sustainability of those resources? What do you think?
Yeah, those programs continue to this day, but those funds have run out. And so we've entered a new fiscal year and are using new resources this year to move forward with those programs and expand those programs.
Great. Are there any lessons learned? I know, you go through this once and you say, oh, I wish I'd done it this way or that way, or I'd do it differently the next time around. Do either of you have any sort of lessons learned that you wanted to talk about?
Mm-hmm. Yeah, I think Shanna's recognition of the return on the investment is a huge lesson learned, and the relationships with grant officers and key policymakers or funders is extremely helpful to be able to, advance our mission and be in the right place at the right time. Because they need to hear that data and they need to hear from us. Otherwise, they may not necessarily turn to us right away.
Shanna, any lessons learned or things you might have done differently?
Yeah, I'd share a couple of things. I think one, it's really pointed out to me the importance of, and I lost my train of thought. Sorry. I think certainly there's been an opportunity for us to think differently about the reporting that we do and making sure that we ask for enough money upfront to do that. And that got a little bit messier with some of these grants that were like very quick turnaround or coming from federal sources that we hadn't really utilized before. There wasn't a whole lot of upfront information about what we needed to collect. And so, finding out after we had already signed the contract that we had to fill out an individual form for every interaction. That's every single warm line call. Every form has 20 plus questions, and we're filling out hundreds of those every month. That's a big time commitment. And so, really trying to get as much information about that as possible. Looking back, I wish I had asked more of those questions. I don't think anybody really would have been able to answer at that point. Some of this was moving so quickly. The other thing I think that I really sort of paid attention to is the importance of kind of negotiating and standing your ground on some of these things. And I would use the FEMA stuff as an example again. There were some data points they wanted us to collect that I just finally flat out said, no, we're not going to do that. That's outside our model. It's outside our philosophy. And we're not going to do it. And for me, if that meant turning down the money, then that's what I was going to do. Because, I'm not going to collect information that is identifying about our warm line callers. That's simply not what we do. That's not what the warm line is about. We have a promise of anonymity to our important elements of our program. They wanted to know the names of our warm line staff. I also elected not to share that information. We just don't do that. And so, it was kind of establishing like, where's my line in the sand? Where I'm like, nope, not going to do that. And if you don't want to give me the money, so be it, but you can make adjustments to programs, I think, as needed. But if you just completely change what you're doing, you have to sort of step back and reassess, I think, whether or not that's the right thing to do.
Yep.
Right. You have to make sure it's the right fit and take a stand when you need to. So you mentioned earlier sort of how small organizations like yours can pivot quickly. Can you talk a little bit about, like, what are the unique aspects of organizations like ours, like Mental Health America affiliates, in terms of going after some of these resources? You want to start us off, Shanna?
Sure. Well, I think, because we're smaller, we are able to pivot fairly quickly, stay within mission, meet needs. And we did a couple of different new programs or services that were temporary during COVID that we just felt like there's a need. We can recruit enough volunteers or find some partnerships and make this work. But I think that's, again, about relationships, and it's not just relationships with funders, but we partnered with the Psychology Association and the Psychiatric Society to create a whole service just dedicated to helping healthcare workers and teachers and others get the support that they needed. There's a lot of things that we were able to do pretty quickly, and so being responsive, and I think our other opportunities were helped by the fact that we weren't generally asking for money to start something brand new, because that does take time to do, to be able to really get something up off the ground. What I was looking to do is scale up and scale out the things that we were already doing, the warm line, predominantly, that was already providing support to people. And we just said, normally this opens in the evenings because that's when everything shuts down. And now literally everything is shut down. The things people depend on to stay well are not available. They need more support, and we can provide it.
Ben, any closing thoughts about what made it possible for you to get those resources, why our organizations are well positioned here?
Yeah, well, I think what Shanna said was so true. It was not a time where folks wanted or needed organizations like ours to start something new. It was a matter of scaling the programs and services to meet the demands that were placed before them, and then the relationships. You can't overstate the importance of those relationships. If you work with a community foundation and the same grant officer for multiple programs that are funded, boy, then you have the ability to pick up the phone and call them, or to email them and say, I see you've got this new opportunity. Is this something that would fit, the increased demands we've got placed on us? And they know you, they're going to answer you. And so that's important. The other thing is, moving forward with other funding, it still comes down to relationships. There's a pile of money that's going to flow to every state, and some of it's going to go through the Department of Mental Health, or your mental health funding authority. And the folks that have relationships are going to be positioned to be able to take advantage of those relationships and work on some important program developments, strategies, and circle back on needs assessments that were done as part of the state planning council, or things like that, and just bring those ideas back into play. And we did that when we knew about all the block grant money coming. We picked up the phone, called the deputy commissioner, and said, are you already done making your plans, or do you need some ideas? Yeah. And they said, hit me. So we made the pitch, right?
Hey, you can't hit if somebody doesn't pitch to you, right?
Well,
So,
you don't get any money if you don't apply for it. And, you've got to be out there thinking things through and pitching ideas all the time.
fantastic. Well, thank you so much, Shanna and Ben. I appreciate it so much. And I think at this point, we will turn it back for some questions.
Thank you, Karen, for telling me that. Hi, everybody. Debbie Plotnick back with you again. And I want to say thank you to Ben and Shauna and Mary, who are all here live with us today. And please do put your questions in the chat. I'm going to remind everybody again that the slides that Mary used will be emailed out to you, and the links will be live in the slides when you receive them. The webinar is being recorded. You'll have it in about a week. You can share it with other members of your organizations or neighboring organizations. And you guys gave us so much terrific information. And one of the points that I heard each and every one of you talk about was relationships. So share with us a little bit about how you've built those relationships over time. And we just heard from Ben how having those relationships will help you get money. We heard from Shanna how the FEMA folks knew that she might be interested. So talk a little bit about how those relationships came to be, please.
Shanna, you want to go first?
Sure, I can jump in.
Okay.
So I think, given the fact that we work on public policy issues a lot, as do a lot of MHAs, that does open up a lot of possibilities for this relationship building that can help you gain funding in other ways. Because I think, for me, I'm talking to a lot of the same folks around public policy as co-chair of the legislative network here in Minnesota, that I also need to go knocking on their door when I hear about federal funding coming in, when I want to talk about our data and the screenings we're seeing and all of that. So the fact that we do, a few different things and we have some different pieces of this work that we do, I think helps us because we're not just doing a direct service piece. We're not just doing public policy. We're kind of doing a lot of things. So I do think that helps. The fact that we have built some of those relationships in the public policy arena, that has also helped us really collaborate in a lot of ways and advocate for each other. In fact, we had, as organizations, we had a meeting just last week here in Minnesota to talk about the funding that was just recently approved in March and where that might be spent, and talking about some ideas. And we were really all kind of pitching each other's programs. And it was really a neat thing to see because we've all really built those collaborative relationships over time, both through public policy work, but also just sharing services and, just helping each other out during a time when we're all seeing increased need.
Debbie, what Shanna said is so true. I've been involved now almost 27 years, and of the 27 years, I think I've been on the state's Mental Health Planning Council for 25, maybe 26 of those years, and been on the regional planning council for all 27. And so what that does is it put me in a position to understand the federally mandated needs assessment process and what needs are identified by stakeholders across the state that are going unfulfilled, and where the state should be working to try to identify how to fill those needs and develop new programs and services and fund them, that sort of thing. And so I've had an extensive career with those two entities, been chair of the Regional Planning Council, chair of the State Planning Council, and now they've kind of put me out to pasture chairing the Planning and Budget Committee. So now every nickel that comes through to the state from any block grants, I have to see it. So I have to be able to identify how it fits that needs assessment process. And so that's a unique place for me. And I'm not giving up that role because I get to make sure we go back and look at prior needs assessments and say, well, what are we doing here? We identified this need 5 years ago, and it's been identified for 5 straight years. So what gives? And so that's a unique opportunity, and that's how I've stayed connected, and I think it's paid off.
That's wonderful, Ben and Shauna. Mary, talk a little bit for some of our newer affiliates about how, if they haven't been around and made friends for as long a time as Ben and Shauna, how you can start to make friends, and at all the levels, at the county, at the state, at the federal, please. Mary, muted. We all keep making that mistake, don't we? There you go. No.
Not muted.
There you go. Now you're on.
Oh, good. Okay, so, it's really like any other relationship that you build. You want to reach out, you want to establish and start conversations. And I think a lot of times people really appreciate knowing what you do for them. So if you're talking to an elected official and you're advocating for their budget, it's always nice to remind them that you are there advocating for the resources that are coming to them, whether that's at the federal level or the state level. And telling them about what you do and sharing the outcomes that you heard so much about in this webinar. People do like to know that what they're funding or what they're involved in is making a difference. I think that's also very inspiring to people. So when you reach out, talk about what you do and how it makes a difference, and then find out from them where they need help. I always ask that question, how can I help you? What is it you're working on that I can be of assistance? And whatever it is, that just starts that relationship going. So I would say share the great work that you're doing. Also ask how you can help them, and don't be afraid to reach out and chat with people in all areas of policy, because you never know whether it's the FEMA person or areas that you might not think resources are there. But once you start talking about what you do, people can make connections.
Absolutely, Mary. Thank you so much. And Shanna hit upon something that was extremely important that's going to matter when you make those connections and you reach out. It's data collection. So tell us a little bit about how the data you've been collecting has helped you really increase the funding that's coming into your MHAs, and as well as, funding for the states and doing advocacy, how that really makes a difference.
Sure. Well, since you called me out, I will go ahead and jump in first. So I think, even in the conversation I just referenced from last week, the pieces that got the behavioral health director's attention from DHS was when I talked about our screening data and my warm line data. That garnered attention. And so when we look at the screening data, for instance, we're really seeing that we were seeing 600, 700% increase of 2020 over 2019 some months. And so we really are starting to look at that as almost a predictor of what we should be doing next. And we're trying to present it as that during a lot of these conversations in terms of this is what we really need. And we should really be doing more things like promotion of screenings and thinking about prevention in the mental health space, not just in the substance use space, because I think it gets left out a lot. And so I'd like to see us take a lot more steps in that direction. Our warm line data has been particularly useful in gaining some additional funding for our organization. And particularly around us asking folks what they would do if they couldn't reach our warm line. Because I think that's a key component that I think we tend to leave out in our data collection is what would happen if you weren't doing what you're doing? What happens if you're not there to take that call? And so we found, we're finding 1 out of 4 people who call our warm line say if they couldn't reach us, they would call EMS, they would call crisis, or they would go to the emergency room. That's 1 in 4. We took 13,000 calls in 2020. That's a lot of avoided EMS, crisis, ER visits, all of that. And so where that's been particularly helpful is starting to assign a financial cost to that, right? It's because it's not free for those visits or those calls. And so for me, I assigned a cost to it, picked $1,000. That's very low, realistically, for what it costs. But let's just say it costs $1,000 for every person who uses those services. And then I started shopping my program to those who have to pick up those costs if people use that level of service. Insurance companies, hospitals, counties, others. And it's working. I've got a lot of buy-in from several different, pieces in there, a couple of insurance companies, a couple of counties, some interest from hospitals who are looking at this saying, wow, you're asking me for $75,000. And based on your data, we would have shelled out more than $1 million last year alone in these costs. And so it's really, I think, not just showing what you do, but what the consequences are if you can't afford to do that.
That's really so important, Shauna. You really made the point about show me the money. You want to show the policymakers where their monies are not only being spent and spent well, but how much they're saving them. The other piece about Show Me and about data, I know Ben can speak to about the suicide prevention programs that his MHA runs and how many lives are saved.
Yeah, the show me the money piece is a hard thing to do, but once you spend your time in those weeds calculating the cost savings, you have an aha moment that you then have to use and share forever, and so, what Debbie is hinting at, and I think you wanted me to talk about, was school-based early intervention. It costs about $7 per kid to recruit the school, schedule our staff, go to the schools, and teach, every fifth grader, sixth grader, seventh grader, eighth grader, ninth grader, mental health 101, which is what to recognize, when to recognize it, and what to do about it. So it's literally school-based before stage 4, if you know what that phrase is all about. But so $7. Well, a suicide attempt that's put in the hospital because there's some injuries, right? Either injuries or stomach has to be pumped, something like that, is $35,000. And that's healthcare costs and work loss cost. So what would you rather do? If you're a mom, you'd rather say, oh yeah, that school better be teaching my kid, right? $7 worth of prevention saves $35,000 of expenditure. And so that is a very real thing to talk about, and we talk about it with United Way and others. So the same thing is true with some of these other things. That warm line that Shanna's running is saving those insurance companies and hospital systems big money. And I've written that note to myself. What would you do if you couldn't reach the warm line? Because we're going to start asking that question. We're going to change that one,
Exactly.
our warm line. So thank you, Shanna.
Yep, it's about data. So we really want to stress that data is so important. The outputs are important, how many people call, how many people you serve, but those outcomes are the ones that really resonate with the policymakers. So thank you.
I have one
so
more
much.
piece, Debbie, to tell you real quickly.
Ben.
The screening data that National can give each affiliate is quite robust. And when we talk about a pot of money that's available, the December block grant additional money, or the March, which was COVID-related mental health block grant money, both of those block grants really want to know how are you going to serve, or how's it going to connect to the priority population, which is the SMI group, right? Persons who are seriously mentally ill. The data in the screening data really gets to folks who are moderately to severely impaired by whatever that condition is, whether it's depression, bipolar disorder, anxiety disorder, etc. And it was that data that led our state to go, aha, we are funding for 2 affiliates, mind you, the year-round mental health screening campaign. And they use that December block grant money. So that data is really key, and you got to know where to dig and find it.
Yeah, it's really important. One other piece I want to pick up on before we close is Shauna said something important about the FEMA grants and other government grants, that sometimes they ask questions that aren't appropriate for us to answer because they really violate people's privacy and they go against Mental Health America's philosophy of putting people and their needs first and protections. So these are really important issues, and feel free anybody to jump in here. But I have often found, and especially in COVID, that when the grants and the monies and things are going out the door really fast, there are folks just like us who are trying to get it and help everybody, but they don't always think about all those things. So even saying no doesn't necessarily mean you won't get the money. And even if it does this time, because they're following formula, talk about the importance of educating people who are asking, putting out the grants and asking these kinds of inappropriate questions. Shauna, you're muted.
Yep, there we go. My dog was barking in the
Excellent.
background,
There you go.
so I tried to mute earlier. I'll jump in first, just real quickly. You know, because I did speak to this earlier in the webinar. I think for us, we've established pretty clear boundaries around what our programs do, what they are, what we'll share, and I think having that ahead of time, really having a good understanding of kind of where your line in the sand is really important, because then you're really clear about what you will or won't, what line you will or won't cross. And, you know, as I noted earlier, you know, it doesn't mean you can't make shifts. And we did a little bit of that, you know, in terms of data collection for this FEMA money in particular. But there were certain pieces where I was just like, that's just not realistic. And I was able to work with them mostly to find some workarounds, you know, and as an example, you know, they wanted us to identify the county and zip code of everyone. I'm like, we don't ask people their zip code. We do ask for county. And so we largely have that information, although some folks won't even share that. That's just reality. We don't have a zip code for everyone. And I'm not going to ask that because that starts to feel too personal to a lot of folks who are seeking anonymous help. How about if I just assign a zip code for that county to each county, and that's how we track it in your system? We made it work, you know, and then we found a solution for, you know, how they wanted to assign people who would not share any of that information, you know, because it's literally in their system. You can't leave it blank. So, you know, we agreed with them, we would assign it to the county that had the highest percentage of calls coming for it. So there are workarounds that you can do, but I think it's really about kind of establishing, this is who we are. It's just too important in terms of our overall philosophy of how we offer programs and services to bend on some of those things.
Great. We've had, oh, Ben, did you want to say something? Go
Well,
ahead.
I wanted to just share that some other funders turned to us years ago on our call center and asked the same types of questions, but we had to prove how many unduplicated people we had. So we had to show them how our system operates and the data system operates to assign a ID number to each person. So they never got to see names, nothing, but we had to be able to demonstrate we were collecting information from unduplicated people, and we had a means to you know, find out what was going on. And in particular, we were able to ask the very unscientific question, can we call you back? And you know, what's interesting is the old-timey call centers, information and referral businesses that MHA affiliates had years ago, you know, they were definitely afraid to ask, you know, anyone's name. Everyone was an anonymous caller, right? So when we asked, can we call back? You know, we were getting 95, 98% of people month in, month out saying, yeah. And so that kind of proof times had changed a little bit, but it allowed us to complete the biggest piece of outcome measurement, and that is to find out, did the person take the information we gave? Did they seek help? Did they enter treatment? And are they making any progress on their recovery plan now? And so that's a much better outcome because we were able to ask that question. So I would never give it to FEMA or anybody else, but it was a way to get past some of the doubting that some outcomes gurus had with United Way and stuff like that.
Sure. Well, it shows the creativity of our affiliates. And we really appreciate everybody joining us today. I want to again thank Ben Harrington and Shauna Mulvihill and Mary Giliberti. And I want to invite everybody to join us next Monday at the same time. We'll be talking about maternal mental health. Again, the webinar is recorded. You'll have the recordings in about a week, and Mary's slides will be available to everyone. So thank you all again for joining us today, and I hope to see you next week.